The nose is another very interesting, very challenging area of the face. And these are some of the common things that I address from a cosmetic standpoint in patients who are concerned about their nose. Bump on the nose is a very common concern. Some downturning or droopiness of the tip, some widening of the tip, and then that can often be combined and often is combined with improving the breathing through the nose as well. Another somewhat of a side note, I'm often dealing with the nose for some other unfortunate reasons, such as trauma, someone gets injured in the nose. The nose also is a common place to see skin cancer, so don't forget your sunblock. And I often will be treating the nose for skin cancers. So here's a great example of kind of a lot of those all combined into one. So this was a woman who had trouble breathing through her nose, and I'll show you another picture that shows her septal deviation. She also had a hump on the top of the nose, which she wasn't really happy about. The nose was shifted off to her left side, as you can hopefully see in that picture, and afterwards moved it right back down into the middle. And when we look down from below, I think you might be able to see this is the septum. The septum is the division between the two sides of the nose. This is her septum right here, and afterwards she has a nice, more triangular shaped nose, and she's able to breathe much better. In fact, I saw her back recently. This was a few years ago when she had her surgery. I saw her back recently, and she unfortunately ended up with a sinus infection. She said, "It's so weird. I had a sinus infection, but I could still breathe through my nose really, really well." So a few other examples of that, especially just removing the little hump on the nose, turning up the tip, which I did in this young lady, and just kind of giving an overall more balanced appearance to the nose. The ideal nose in many people just kind of fades away into the background of the face and allows the other finer features to really show. This was a good example of a young man who had an injury to the nose and was able to move the nose back into the center and just give him the nose that he used to have. Kind of similar example to that, a young lady who fell off of a horse and broke her nose, and I was able to correct the cosmetic concerns at the same time. You can still see, hopefully, that she still had a little black and blue mark from her injury. Occasionally the nose can be abnormal or altered from birth. And this was a young woman who had that condition and had really always been this way, and was able to just kind of give her the nose that she hopefully would have been born with if it hadn't been deformed, perhaps in the womb or even during delivery. We sometimes find that happens. And lastly, revision rhinoplasty, which is doing a second nasal surgery, is something I also do commonly. And this is a woman who had surgery about 18 years ago, and they kind of just took away too much. They didn't leave enough support in the nose. So I actually had to rebuild her nose from some cartilage in her ears. And this is a kind of similar example of that. It was someone, she had actually had an infection and lost a lot of the cartilage due to the infection. So again, rebuilding the nose. I mentioned this or touched upon this earlier. Otoplasty it's really it can be quite a life-changing operation for young and old. Here was a woman who had just always been very self-conscious about her ears and always wore her hair in front of her ears. And I think the picture speaks for itself, how excited she was to have her new ears that she could actually pull her hair back. This young man was quite interesting and a very, very smart beyond his years boy. And unfortunately, his ears kind of really gave him a bit of a reputation at school that didn't really fit his personality. And so afterwards, he was quite pleased just being able to be more of an adult. This young man actually, it's pretty rare. Actually, I think there's probably only one example, and it's this one, of someone who had their otoplasty or ear reconstruction covered by insurance. He had severe OCD, the medical condition, obsessive compulsive disorder, and having these prominent ears really affected him a lot. And he also, I think his one little outlet was playing football, and he wasn't really able to wear a helmet because of how much it hurt his ears. So part of his OCD was he didn't like his picture taken and couldn't really keep his eyes open for the camera, hence his eyes being closed. but certainly a dramatic change for him. There's not a lot of cosmetic surgeries I do on kids, and certainly some of them can be the cutest little things that I'm able to see. Lastly, but certainly not least, laser resurfacing and laser procedures in general are really a big part of what we do at the Aesthetic Center. And one of the neat advances we've seen in the past decade is the advent of fractional laser resurfacing, which is a way to sort of get some of the benefits of resurfacing the face, which pretty much means removing skin and tissue from the face, with minimal downtime and also with really rapid healing and some great effects. So here's a good example of that. A woman who had seen a fair bit of sunshine in her life, grew up working on a farm actually, and I did a fractional treatment. It's actually been about 5 years now, and here she is afterwards. Might be a little bit hard to see with the projector, but I think you'll appreciate certainly a lot of the sun damage of her face has been reduced, and her skin tone and texture have really been improved dramatically. And she tells me a lot how much she appreciates this because this is my mom. Another good example of that, you may be able to see that. It might be a little challenging with the projector. Any questions about laser resurfacing while I have some of these photos up? So another great question, is there a limit to how many times the face can be resurfaced? And the answer to that is yes and no, unfortunately. I wish I could give you a straight answer. In the past, using a complete, what's called an ablative laser, which I kind of liken to taking a bulldozer to the skin of the face, it really would remove a significant amount of tissue, and after that, that really can't be repeated too many times at all. With fractional laser, which the analogy I use is kind of using an aerator for the lawn, kind of just removing a percentage of skin, it can be repeated many times. In fact, I've found some clients really every 2 to 3 years will actually continue to see benefit, but also see an added benefit with those repeated treatments. So, good question. It's a very exciting day today, despite us being here. For the Aesthetic Center, we actually just received delivery of our newest addition to our laser repertoire, which is the Cutera Zeo platform, which in a way it's technically, I guess, 2 different lasers, but it's really 5 in 1, which is really a way that we're able to offer a very updated and effective IPL laser, which is called intense pulse light, which is a way to treat such medical conditions as rosacea, which many of you may be familiar with, and also just some pigment changes in the face with really, we're talking 0 downtime for these sorts of things. It also gives us a slightly different option, 2 different options for hair removal, which is another big part of our practice. And lastly, and perhaps one of the more popular things that we see with this is being able to treat such things as spider veins or prominent blood vessels or veins in the legs as well as the face. So this is mostly a laser that's going to be used by Katie and Amy, my amazing staff estheticians. And lastly, we have a slightly new addition, which is laser genesis, which has become, in many practices that had this laser, one of their most popular treatments. And it's a way to really treat the skin on various different levels, both for pigment, for some very light resurfacing, all in a treatment that's pretty much painless and really no downtime at all. So we're quite excited about that, and we're really happy that you all could be here tonight. And I know you're also very, very excited about our upcoming raffle. And without further ado, I think we'll move to that, unless there's any last-minute questions that anyone would like to ask.